Okay, so it looks like we have diagnosed the problem down to that on patients that are younger than 40, we're not performing well. But how did we end up with an old test set that did not contain any patients under 40? Is it possible that when we dropped missing cases, we dropped a lot of young patients? And to test that, we can graph the distribution of the old test set before and after the dropping of the cases with incomplete blood pressure measurements. So here's what it looks like after dropping, which is the same graph as the one we saw before, but here's what it's looking like before dropping. So we can see that there were a lot of young patients previously that after our dropping of cases with missing blood pressure measurements, we got to eliminating a lot of young patients. And why might this happen? One reason this might happen is in the clinic, physicians may not regularly record blood pressure for young patients, but might be a routine part of care for older patients. And there are a lot of patterns like this which can generate a systematic missingness to the data such that when people are young or when people are really old, missing data might be more frequent. And we need to watch out for those in order to build models that are not biased. In a future lesson, we will look at missing data mechanisms and how we can go about thinking about missing data in a more systematic way. So with that knowledge, let's go through this quiz. Take a minute to work through it yourself, and then we'll work through it together. So this question asks, which of the following groups would a complete case analysis be most inappropriate for? Now remember that a complete case analysis would be inappropriate for those for whom we're dropping data, those for whom we will see missing data. The missing data are going to be associated with women less likely to smoke and less likely to be on BP treatment. So we expect that non-smoking women not on BP treatment would be the patient group for which we have most missing data. Hence, we would expect that a model built using complete case analysis would be most inappropriate for that patient subgroup.